Hey, good evening, everybody. Thank you for joining on time. And we're all set to start the today's webinar. And this is Bhanupriya. It is my pleasure to welcome you all to today's insightful webinar, The Champion Within Navigating Your Success in the Field. This session is designed especially for future medical professionals like yourself and promises to offer both academic and personal value. We are honored to have with us Dr. Samir, a distinguished psychiatrist and a leading voice in the field of mental health. Dr. Parikh serves as the Director of Department of Mental Health and Behavioral Sciences at Fortis Healthcare, an alumnus of Civil Hospital Ahmedabad. He has consistently ranked at the top of his academic career and is known nationwide for his work in clinical and community mental health. Dr. Parikh is not only a seasoned expert but also a passionate advocate for mental well being. His dynamic approach has made him a sought after speaker as both national and international platform. He has been instrumental in leading numerous awareness initiatives connecting mental health with real life performance and success, particularly in high pressure fields like medicine. Today, drawing from his latest book, The Champion Within, Dr. Parikh will guide us through strategies to build motivation, enhance focus, overcome setbacks, and develop a mindset geared for success. His talk promises to equip you with practical tools that are essential not just for academic excellence, but for long term growth and resilience in the medical profession. Please join me in welcoming Dr. Samir. Over to you, Doctor.
You can see the presentation, right?
I'll stop sharing.
Yes, we can see the presentation.
Yes, we are able to see your presentation.
Okay. So absolute pleasure. The fact that I'm speaking to mental health, medical practitioners, young who will become medical practitioners in years to come. So it's always a pleasure to speaking to people who will be practicing medicine. It takes me back, way back to 1989 when I started my career in medicine. And it's now a while back. And so, yeah, that's how far it goes when we talk about the field that when I first got in, and it was so much different at that time. I mean, besides the fact that we also had the 1.5 year um, profs, and which has obviously now changed for the right reason. But as I reflect to it and I see around me lots of time when people talking on the lines of not too many people want to take this field anymore. People feel that this field has a lot of struggles, so on and so forth. But if you were to ask me, then probably the best decision of my life was taking medicine as a career. The best decision in my life was taking psychiatry as my post-graduation field. And frankly, that's how I look at it. And yes, you will go through a long journey, unlike other fields. But the fact is that it's going to be a remarkable experience. This opportunity to be able to do good work, have a good career, at the same time do so much good to humankind is probably the only field that is there, and that's the field of medicine. So what we'll do today is we'll talk about some life lessons, and I take you these life in on this journey today through my experiences of working in the field of sports psychology. I had gone with the Indian Olympic team to Paris as their mental health expert as well, and since then I was thinking about that when we work with athletes who have to perform at a certain level, peak performance, high pressure, ups and downs, expectations, hard work, all of that put together. And that's what makes an athlete a champion. And if you look at it from the other side, then we all are champions in our own way. It's not that one person's career is any different than others. Each of us have gone through our own struggles, and we will go through our struggles. So the idea is not to say that that's a champion and that one's a champion. The idea is to find the champion within. And that's the story in sports as well. It's not that the person who's won more Grand Slams or the person who scored more centuries or more goals is only more talented. It's also about the belief that I am a champion and I'll work hard for it. And that to me is the key also to success in the field of medicine that you all now find yourself in. So you need to first understand you are a champion, and then you keep maintaining the champion and your performance, because challenges will come and that needs to be your way forward. Today's conversation that I'm doing is based on my recent book, which is The Champion Within. It's written with my colleague Divya Jain. It's a Rupa publication, and I'm going to largely use this book as a reference for our conversation today. Ask yourself this question: what is the most important quality you hold important for success? All of us may give different answers, and that's the beauty of it. There is no one set answer, yet basic ethic of how you approach life is going to largely decide on how much success you find. You look around yourself, you see these very famous cardiologists, neurosurgeons, these famous doctors, cutting edge work they do in onco and so on and so forth. They all started where you have. They all worked hard and reached a certain level. We see people at a certain level and we feel that they may have got it easy and now everything is easy. There are patients waiting for them. They've all started where you have started, where I started way back in 89 as a medical student, first prof, not knowing anything, and entering an anatomy class. And it was quite a thing at that time, for sure. If I now reflect, didn't know anything. And well, now also I know very little. But that's the beauty of science. So let's start with the first thing, which is making the mindset of a champion. Here, making the mindset of a medical practitioner. And to become a medical practitioner, you need to first go through your 3 profs well. You go through your medical education well, then you will have your higher education, so on and so forth. So how do you do that? The key is the basics. John Wooden, famous athlete, had talked about champions are brilliant at the basics. People who have the basic approach to life on track, time, work ethic, doing things on time, staying focused, knowing when to take breaks, feeling good about oneself, testing one's own self, putting in more challenges to one's own self, having that approach to life, help seeking, talking to seniors, reading at the right time, maintaining your reading, not taking long breaks, all of that becomes your basics. If your basics are on track, your success is going to be on track as well. So what makes a champion? In this case, what makes you, or what will make you a famous doctor in years to come? Your commitment to the field of medicine, your commitment to your own self. Nobody needs to come and motivate you. You need to be committed to what you want to do. This is your life. This is your career. This is your aspiration. This is your goal. You have to be committed to it. Nobody else is going to be. And you need to find that competitiveness in you. Being competitive is not getting more marks than someone else. Being competitive to me is I bring my best game always. So let's say you're now practicing. It's, this conversation happened, let's say 15, 20 years back. You see a patient in crisis, you help that patient, difficult patient recovers. That does not mean that the next one you will take it lightly. The next patient, you will have to bring your A game all over again and all over again. That's the key. You may do one highly difficult cutting edge surgery and it goes very well. You'll still need to put in the same effort in the next one, even though it may be relatively easier than the previous one. That approach to life is the key. So competitiveness is with your own self. Don't ask for motivation from outside. How much you make, how much money you get, what designation you do, all of these minor things which will lose their meaning. What will matter is, do you like what you do? Do you find a sense of purpose in what you do? Are you enjoying what you do? Do you want to do what you do? That's motivation, young people. And stay with that motivation. Never let the fire of motivation die. People with intrinsic motivation, people who like doing what they do and find a purpose and meaning in it, those are the people who do very well in life. Have a vision for success. Your life, your goals, your aspirations, your vision, your success, and have that focus in your life to be able to do well, and then focus on quality. Quality is very important. How many hours you study won't matter. What will matter is, have you made sure that you've studied well? So those aspects need to be seen. You may have read 20 journals, but what did you understand from it? Similarly, you have to maintain the quality. Like I just gave the example of an emergency patient, that applies to all of us. Let's say I saw X number of patients in the OPD, and I'm tired now by the end of the day. I've seen a lot of patients. It's not the fault of my patient that that individual is 10th, 15th, 20th, 30th, whatever number you want to do on the list. For that patient, it's still the most important thing for their life. So I can't let my quality go down because I'm feeling some fatigue. I will need to find my break, but bring my A game there. I will have to learn to cope with pressure. Imagine you are a cricketer, last ball, you need to score a couple of runs. The whole crowd is seeing you. You are being beamed across. Take an example of some of these super overs. Take an example of penalty shootouts. You may be the greatest athlete of all time, but you need to go through the pressure to be able to hit the ball to the net. So you will, and that's what medical practice will be. Patients, because they're struggling, you may feel the pressure. Family pressure is there. Your own stuff is happening. You may have internal aspects going on. You'll have to deal with it. Today, you may have an anatomy exam or a physiology thing coming in, or if you're in third MBBS, you may have some class happening here and some exam happening there. You're in your due term, you also have to study. Well, this is how you cope with the pressure, because it's this pressure which is going to eventually help you navigate through the field of medicine. Be realistic. I believe that being realistic and knowing one's strengths and weaknesses is important in life. Because when you be realistic, you'll also know that, okay, I don't know this well. Let me put an effort. Eventually, when you're practicing, you'll also need to know that, okay, this is not something which has the greatest outcomes. This has. So how do I go about it? Confidence is not a facade. Confidence is not what you portray. Confidence is what you feel. If you feel it, it'll show in any case. Arrogance is when you don't have confidence and when you show it. Low self-esteem is when you're feeling inferior about your own self. You will become a medical practitioner. Just imagine the percentile, the odds of it. Look at the population of the world. Look at the number of people who are in medical practice. I mean, just look at who you are, the champion. So keep reminding yourself that how many people would have taken an entrance exam, 12th boards, entrance, other entrances, and so on, and how many people actually reach. So you've already reached a particular level, now just have to maintain it. Be aware of your game, which means be aware. You need to know when to score faster and slower when to dig down on a test match. It's a windy day. You need to just stay put so that you don't lose wickets. To be aware of that, you need to know that there are certain weaknesses that you have. So what do you do? It's this zone, you need to avoid something. Similarly, be aware. When are your exams coming? What do you need to study? When do you take your break? Sometimes you bring more effort. Sometimes you take a bit of a break. How do you do that? And make friends. There is no substitute to that. Make friends. Friends in your college, friends with your seniors. This friendship will last a lifetime. And throughout your career, even when you are working in hospitals, your own practice, wherever you are, keep making friends, colleagues as friends. It's not that the school's over, so there won't be any more friends. That's not true. Wherever you go, build relationships and friends. That's the hallmark of a champion. You are committed, competitive, internally motivated. You have a vision. You maintain quality. You deal with pressure. You're realistic and confident, always aware, and you make friends. That's what is the making of a champion. And that's medical practice for you. All sorts of things will happen. There may be a tsunami, some rain, some thunderstorms also. The bridge may be broken and started all over again. All sorts of things will happen. There's only one thing that you don't know very well, and the examiner comes to ask only that. All of that will happen, part of life. Enjoy every moment of that. Now let's look at about setting the right goals. How do I do that? That's something that needs to be understood as well. Setting the right goals. Michael Phelps, as you know, very famous athlete, famous Olympian. I think goals should never be easy. They should force you to work even when they are uncomfortable at times. I think that's also described in medical practice, isn't it? I mean, medical education, MBBS, I mean, was one of its kind of an experience. So, but remember, these are your own goals, not somebody else's. You break them down, but you be specific. And then you think about the process and not the result. It's not about I need to pass and get so many percentage. How am I studying today? Am I doing my practicals well? Am I prepared for the Viva? Am I learning to share what I learned as well? Am I able to write the correct way and narrate it also? Am I getting more oriented to my subject, not just on books, but actually? So those aspects make you a better clinician. I've always been fascinated by this, and Vince Lombardi had said this: practice doesn't make perfect, only perfect practice makes perfect. So it's not just merely how many hours you're putting to study, it's also how well are you studying. And this has always fascinated me. Imagine you are a 100-meter sprint athlete representing your country. What it means is that your time during the Olympic or the World Championship will be over in about 10, 12 seconds. So for 4 years, you work so hard for that 9-second performance. So your 4.5, 5 odd years, 4.5 years of medical education, and then one exam that happens over a couple of days is what defines it, right? So every time you feel that it's such a long journey, think about an athlete who has about 10 seconds every 4 years. So what do? You get better every day. I just said that I don't know much, and that's true. If I were to falsely believe that I know everything, including in psychiatry, that's absolute rubbish. On the contrary, like my teacher always told me that the third-year resident doctor knows more than anybody else on a given day because they are presently learning and studying so hard. So you keep improvising, get better, don't get complacent. Practice performance. What here means is learn to talk as well, meaning a lot of us may have theoretical knowledge, but when it comes to speaking, we struggle. So we struggle in our Viva exams. Also, you may then struggle while talking to a patient. So your Viva is like a preparation for your actual clinical practice. And you may know that I have read well, but you may also be struggling to write the answer in a correct manner because you know it all, but you've not practiced writing. So practice performance either ways. If you were a clinician already, I would have told you, get your basics right, get your anatomy fine, go to clinics, go on all your rotations, see firsthand what's happening, because that's how you will develop the right kind of skills. Simulate pressure, something I tell students a lot. Make your own exam, test each other, pick up a book, start shooting questions at each other, work within your strengths. Please enjoy. You may be a medical student, but that doesn't mean that the only time you enjoy is once a year during the 1 week of sports day or 1 week of extracurricular. Take time out regularly. That will bring the best in you. Serena Williams had said that if you can keep playing tennis when someone is shooting a gun down the street, that's concentration. A lot of times people come and say that, I'm studying in a hostel, the other room, there's a lot of noise happening. And my response to them is, how does it matter? You are here, you study. Imagine you were giving your exam, final exam, and there is some noise coming from the street or something happening outside the corridor. That does not mean that you'll start looking there. You'll still have to be here and finish it off. You may be a neurosurgeon doing cutting edge, just about time. You have to make that little break here, and then you get distracted by something happening. That's not how life works. The science of focus is the quiet eye, which basically means stay right there and don't be distracted by that. Dissociate from everything that's happening around so that you're right at focus. What is on your control? What you are doing. What is not in your control? What others are doing. Simple as that. The here and now. The more you learn to focus on the here and now, the better you'll be in life. And also have some fun. Mario Andretti had said that it is amazing how many drivers, even at Formula One level, think that the brakes are for slowing the car down. Right? Timeout break is for peak performance. You do a pit stop so that you can rejuvenate yourself and get your car back on track as well. That's 3 second break actually makes a difference. Applies to all of us. You have a long OPD, you need to take some breaks. You are studying hard in your due term, you will need to take the break so the mind gets refreshed and be able to be back at it. That's how successful people do well. That's how champions are formed, where champions find that ability to switch on and switch off. The key to life is knowing when to switch on, when to switch off, when to switch on again. And this will apply to almost everything you do in your life. So you plan your breaks, time it right. My suggestion, 45 minutes odd, is what you should do at one go. Studies and take a 5, 7, 10-minute break every time. Break should be outside the room where you were studying. Take some physical activities, listen to some music. Don't stop playing sport. And you will realize that your physical and mental fitness and your social fitness will actually help you perform so much well academically. LeBron James said that when you get that good sleep, just feels like, okay, I can tackle this day at the highest level. You need to balance it and practice and prioritize mental recovery, sleep, diet as nutrition, sleep, exercise, relaxation, music, a bit of yoga, social. All of these are going to prioritize your mental health or mental recovery, because when you study hard, but you'll also need to take an adequate break to be able to perform at a certain level. And that is the right balance and you find the balance with alternate stressors. Alternate stressors means things that are an alternate to what you do. So in my case, I love listening to some classical music. I love reading. I love spending time with plants. So I know that what I can do when I need to take a break, I'm feeling stressed. That's the balance. And these are alternate stressors. You all will need to find and define your own alternate stressors to be able to do well. So create your distractions in a creative way and ensure that you sleep at the right time so that you don't sleep in class. Muhammad Ali had said, if my mind can conceive it, if my heart can believe it, then I can achieve it. Remember, you are a medical student. Millions wanted to do it. Millions would have given anything to be able to be a medical student. You are a medical student. So all that's now left is bringing and keeping that belief inside. And remember, dreams are free, just keep dreaming. And the more you dream, and then you make sure that you achieve your dreams. You've already entered the gates of medical education. Now you come on the other side as a medical doctor, walk a few steps more and then get specialization, walk a few steps more, have super specialization, walk a few steps more, and then serve humankind. Like I said, there is no other branch as medicine. You don't compare. I don't compare myself to a colleague in neurosurgery. They're brilliant. I mean, I can't even think about what they're doing hours into a complex surgery. I don't compare myself to the complexities of any branch. I think people in onco are remarkable when they go through the kind of pressures that they go through. But at the same time, I am a psychiatrist. So why should a psychiatrist be comparing themselves to a neurosurgeon? Different field, different branch. You may be a batter. You don't need to compare to a bowler and vice versa. You may be a great table tennis player, but that doesn't mean that you'll play well in tennis as well. Don't compare. You focus on your uniqueness. upon is as important as the rook or the bishop or the queen. It just depends upon what you know you can do and you live within those aspects. But you keep testing yourself. Be open to feedback. One of the things I feel a lot more in more and more younger people that I meet, that sometimes people are not as open to feedback. They're not open to learning more. They feel there's everything written on Google, so they'd much rather go there. They also feel that when they are given feedback, they feel that they are being critiqued or criticized, which actually is not true, young people. Feedback is the only way you'll change. How else would you change if somebody doesn't tell you? A mirror is a mirror for the right reason, because it tells you who you are, what you are doing, so that you can bring some change in yourself. And you should know what your strengths are. Celebrate every win. When you are a medical student, when you go from one prof to another, when you identified an important tissue in your micro class, when that you remembered that one thing, when that you were able to read more journals, all of those are wins. Mike Tyson had said, fear is like fire, it can help you if you know how to use it, if not, you'll get burned. So the Yerkes-Dodson law also says that if you don't feel stress, your performance comes down. If you feel a lot of stress, your performance comes down. Optimum stress, optimum performance. So you embrace that restlessness, that adrenaline that you feel when you're going through an exam situation, especially when you're studying in your last few months before a final exam. And then there you decide that how do you fight it, because you don't need to flight or freeze. And that's the idea of the embracing that is required. Accept the stress. Is medical education hard? Yes. Was it hard from 89 to 95, my medical education? Oh, absolutely. Was it worth it? Most definitely. Were there times when I did not enjoy it? Yes, I did. Were there times I thought the pressure was too much? Yes, I did. But did I come out of it because there was so much support and help available? Yes. Did I have very bad exams? Yes. Yes, finally in psychiatry I topped the university. But that doesn't mean that MBBS or even in psychiatry it was all easy. No, it wasn't. So I accept the stress. That's life. I will accept it and I'll also enjoy it. In fact, my most favorite time in my career was my examination, post-graduation examination of psychiatry. I think I enjoyed that most. Not third MBBS, but surely my specialization exams. Psyching up, psyching down, which is self-regulation, which is a different form of switch on, switch off, which means bringing that arousal in a way that I'm able to perform well and then being able to relax completely. It's like what used to happen during our times in the theory exam. You had a theory exam on Monday, Wednesday, Friday. I'm talking about surgery 1, surgery 2, theory exam on third MBBS is what I remember now. So you give the exam on Monday and you're so exhausted. So if you don't psych yourself down, take a break before you psych yourself up again for a Wednesday exam, that holds the key of regulation. Dojkovic said that conscious breathing is a big part, especially in the moments when you are under tension. Conscious breathing, knowing when to relax it off and then to be able to get it back there. So psyching down and psyching up, that's how you go through some of the difficult moments. In young people, there will be a lot of difficult moments in your career. And that's where you will know when to switch off and switch on. And remember, there is a coach within. Like I talked about, there is a champion within. There is a coach within also. Master the art of self-talk. And Pete Sampras had said that you have to stay relaxed and keep your mind clear. I would tell myself to take it one point at a time, no matter the situation. Don't think about the third exam when you're studying for the first one. Get through with this and then we'll approach that. What you say to yourself matters, which means remind yourself that what you are good at. Learn to keep it positive. Most importantly, be kind and be kind to your own self as well. Don't push your body and mind to a level that it goes through a feeling of a burnt out or a breakdown. My favorite, Sachin Tendulkar had said that success is a process. Medicine is a process. The career in medicine is a process. During that journey, sometimes there are stones thrown at you, and you and I will have a lot of stones thrown at us in the real figurative or in the virtual, we will be criticized a lot because the expectations from us are also so much more. And you will convert them into milestones. And that's going to be your career, rolling with the punches and overcoming setbacks, because setbacks will happen. If you treat 100 patients, all of them will not get fine. That is always going to be the struggle, but you will still have to bring your A game every time you have an interaction with any patient. And that's how your life would be. Be psychologically flexible, which means don't be rigid. Be willing to learn, be open, be willing for feedback, change strategy. Don't judge too soon. This is like that is like that, this won't happen, that teacher is useless, I can't do well, that teacher doesn't like me, that senior doesn't like me. Your life, your goal, your aspiration, not somebody else's. Life will keep giving you learning moments. My learning moments were when I was in Paris during the Olympics, and I saw such tremendous stars of our times and how they would approach the game, how they would approach the match time. This is the learning. In fact, the whole idea of the book Champion Within came from that experience. Life will keep giving you learning moments, including when you will have an adverse reaction or a side effect that you didn't anticipate in a patient. That's also a learning moment. Yes, difficult aspects, but a learning moment. But you stick to the plan. Keep reading, keep upgrading, keep updating, keep balancing, keep moving forward. That is what will take you to your success, and never hesitate to reboot. Anna Goucher talked about racing. The racing is the fun part, it's the reward of all the hard work, which basically means this what is the result after racing is not the important aspect. Racing is the fun. So it's the inner drive. When I talked initially about motivation, I talked about intrinsic motivation. So you will need to revisit your motivation. You aren't doing this for someone else. Don't allow yourself to believe that you are in the career of medicine to make someone else happy. Your parents, your siblings, this society, that person, this one. No, this is for you. You want to do this, your career, your aspiration. But yes, on the other side, you'll actually be able to help people. And that makes this branch so absolutely wonderful, that while doing your work, you're actually helping someone else. The purpose is healing others. The joy is in the path of healing. And that's what one needs to understand. Rafa said that I put the 2 bottles down at my feet. It's a way of placing myself in a match, ordering my surroundings to match the order I seek in my head. You will all need to learn how to get into the zone. Zone before an exam, zone while you are studying, zone before a surgery, zone while you are doing an OPD patient, zone before a procedure, zone before going through a diagnostics, zone while explaining to the family. You get into that zone so that at that time you're fully there, mindfully aware, and not about anything else. You have your own pre-game routine. I tell everyone, what works for you, you figure it out when you are studying. You don't need to see how others are doing it. That doesn't matter. You figure out what works for you. Bethany Hamilton said that courage doesn't mean you don't get afraid. Courage means you don't let the fear stop you. Of course, we'll all struggle, like I've been saying. There are a lot of struggles, man. My first test in anatomy, I was terrible at it. And I realized I need to study hard. I still remember struggling with biochem. Forensic was a bit of a struggle. OBGYN was struggle. Micropatho were struggles. But you will have to do it. I mean, if I had to become a psychiatrist one day, I couldn't choose not to do micro or patho at that time, right? It was a path. So I had to do what I had to do, even if it was difficult, even if it was scary at times. But you have to do what you have to do to be able to achieve what you want to achieve for your own self. And that's your big day. The only difference between us and some of these other branches is that for you and me, every moment is a big moment. There is never going to be one big day in your life. First MBBS, second, third, so on and so forth. Entrance exam, you get through, you have to still pass that. actual postgrad. You finish that, you have to get through something else. You finish that, you have to get through something else. Then you'll start practicing. You have some great patients, but you'll have to keep doing well every patient, every time. That's life for a medical practitioner. So for those who have a big match, a World Cup, a tournament, for you, it will be every cross section with any individual you meet who's coming to you where you are the doctor and they are the patient. And that's our life. If you look at that, that each moment is a moment to cherish, each moment is a moment to celebrate because we are learning every moment. We are going through so many ups and downs, and that is the joy. The struggle is the joy. Sometimes not getting that sleep is the joy. The anxiety before examination is also a joy. Having a poor exam and laughing on it after after a while is also a joy. That aspect of life is something we all need to learn. You will always have a before, a during, and after. Before an exam, during an exam, after an exam. Before a patient, during a patient, after a patient. Before studying, during studying, after studying. All three aspects are going to be important, from motivation to the process to how do you learn and move forward and keep your vigor on, keep your motivation on, and that makes the cycle complete. That makes the winning attitude. That at each stage of this phase, you are always having the winning attitude. So you ask yourself the question, what makes your winning attitude a winning attitude? Because life throws curveballs, champions will rise above self-doubt. So this conversation that I had, and now I'm going to be open for taking questions, is from the book I've just written, The Champion Within, where I look at these sports psychology examples that can be used by all of us. It's a Rupa publication. Feel free to have a read. If you want to be a part of mental health and social media change and bring change and be an advocate for mental health, feel free to join us. Forest Mental Health for tips on our WhatsApp channel and our YouTube channel. If you want to write to me, you can write to mentalhealth@fortishealthcare.com. Young people, we may all be have stress. There will be times, young colleagues, you will go through some distress. Please don't hesitate. You can call us. In 15 odd languages, we are always available. If there is a crisis, reach out to us. 837-680-4102. That's a crisis helpline by Fortis Healthcare. And on behalf of our organization, my suggestion to all of you, unmute yourself. Unmute yourself on the world. Express yourself and keep moving forward. That's the message that you all need to have. And now I'll be happy taking questions. You, whichever way you prefer, you can either write the questions or whatever is your format. I'm open to that.
Doctor, we have few questions in the Q&A.
Okay, I'll have a look at. By the way, I just read that there's somebody from BJ Medical College, Ahmedabad. I'm an alumni of that. In 1989, I walked into as a young 18-year-old in BJ Civil Ahmedabad. I just saw someone there, Aryan Parikh. Well, young colleague, we walk the same wards. But yeah, where are you have to tell me which the questions are because there are a lot of messages.
Yeah, we have a few questions. And one scholar is asking, what strategies can people use to stay motivated over time, especially when progress is slow?
There is no fast progress in life, first of all, right? No progress is fast. So progress is slow. Even 2-minute noodles are not making 2 minutes. That also takes about 5 to 10 minutes to make them actually. The other part is this is your life. I'm here because I see this as what I'm supposed to do. It's a Sunday evening. I don't need to be here. You are here because most weekdays you don't have time because you are studying hard. That's the effort. How will this conversation help you and me? We don't know, but it would in one way or the other, some corner of our life. Motivation is all yours. It's not coming from someone else. Your life, your career, your aspiration, simple as that.
And the next question, uh, indeed, so MBBS is great profession, but at times it becomes very difficult to cope with the first failure in the terminal after being the topper consistently till 12. What to do?
Oh, you are right. Like I told you, when I walked into BJ in 1989, it was an absolute nightmare in the first week, because you walk into a college, because all of you are toppers, all of us were toppers in our own schools, and so on and so forth. I mean, what, a lakh plus student take part, a few thousand students get selected, and then you realize that everybody in your class is a topper. So suddenly you realize that, listen, you have to stop comparing yourself to others. Everybody will have their own career path. Somebody will take this, somebody will take that. You go one day at a time. You see how well you are doing. If you're not doing well, up the game, figure what is working for you. So some subjects will come better to you, get them on track, then move to the next subject, which is more tougher, and then keep working at it. There is no other way around this.
And the next question, so which branch should we take so that we can progress fast in our life and take
There
the
is no fast.
responsibility of the
There is
family?
nothing fast in life. You choose a branch that means something to you, that you enjoy. Right? There is no other way to see this. I don't think there is any branch which is better than the other. Everybody will have to choose what they like. Sometimes we may end up choosing something that we may not like initially. But if that's a choice life has given us and we didn't have an option because of various factors which were not in our control, go ahead and like it. Go ahead and enjoy it.
And the next question, so being a good student in medical college, being surrounded by pressure of doing good every time is right. How to manage at that time?
You won't do good every time. You won't perform well every time. How's that even possible? Sachin Tendulkar scored zeros and centuries. Um, Ronaldo has missed penalties and scored some brilliant, right? Um, the legends, the big three, the Deutschewicks, the Nadals, the Federers, all have had first round exits also. I mean, that's life. Don't allow yourself to feel that it's a pressure that you see. You need to be at your best that you can be. Some days your best may not be enough. Some days you may not be able to bring your best, but you stay within, you recognize it, you keep learning and keep evolving. That's the way to look at it.
And the next question, sir, I become very anxious when I see I am giving more effort than other, but result it not so good. What to do?
First of all, please don't compare yourself to others. See how well you are doing in compared to your own self. If you feel that you are feeling anxiety, learn to take breaks, simulate exam environment, test yourself, do some breathing relaxation, listen to some music, drink some art, take some breaks, have adequate sleep. Please say no to substances. Young medical colleagues, say no to substances, say no to self-medication, say no to the beta blockers and the benzodiazepines, say no to the cannabis and the caffeines, say no to all of that. Those are all things that will be given to you by your information given to you by somebody or the other around. That's all rubbish. Say no to the modafinils and no to the stimulants. All of that is nonsense.
And next question. So I become very anxious when I see I am giving more effort than others. Sorry, we just closed that. And as a senior told us that first year of for enjoy and you have to study for 4.5 years. So what is the right and what is the wrong?
No, you don't. You enjoy all the years and you work hard all the years because you are a medical practitioner. You will work for the rest of your life very hard. So every time you think that you can just sit back and enjoy, no, but you enjoy the process. You still enjoy what you do. You take breaks, yes, but every day is going to be an effort. Nobody puts less effort on any given day to have results on that day. That's not how it works.
And the question, I don't feel like doing medicine. What should I do now?
Say that again.
One scholar is saying, I don't feel like doing medicine. What should I do now? Maybe he or she already started with medicine.
So if you are saying that if you are feeling that you are stuck in a career, I think you need to talk to someone. If you have started taking medications, as long as they are prescription drugs, it's all fine. Prescribed by a doctor and not self-prescription. What I meant here was do not do self-prescription, which means don't do self-medications. Medications per se prescribed by an expert is absolutely fine. And if you feel stuck in a career, you need to talk to someone.
And something is related to academics, sir. Is it so necessary to be along with the syllabus daily, which is taught us in the class?
We did not have in our times an understanding of a syllabus. You read more books, you read more reference books, you read journals, you have discussions, you're open to what's happening in the world, and that's how you become a medical expert.
Next question. You have told to balance study and fun, but I have a fear that if I am engaged in fun and all, then I would not be able to complete my studies. What to do, sir?
There are 24 hours. Take a few hours for your sleep, take a lot of hours for your studies, and give a little bit of time if you can for taking a break as well. And that's when you have fun. And also enjoy studying as well. But don't allow yourself to believe that if you don't sleep adequately, you don't have fun and you're just going to keep studying and keep studying and keep studying. The fatigue will down your performance. If you don't balance your fatigue, your optimum performance will not happen.
And there is one question in chat box, sir. If we will not compare, then how can we know whether we are going in a correct path?
But I'll compare to my yesterday. Why should I compare to yours? Why should I compare to some other psychiatrists how they are doing? Why can't I find the content in how I was and how I am? Why should I look at what a neurosurgeon or an onco is doing? I'm a psychiatrist. Similarly, why should I see what somebody else is doing? I mean, I will do based on what I am. There is no other way to look at it.
And there is one question, maybe most of the youngsters worried or thinking about it. So, will it be good to find love in college? Will it affect this study?
You will find love in college. You don't have a choice. It's good, it's going to find you. You'll have your heartbreaks also, like it or not. That's learning of life. I mean, that's the journey that all young people have to go through, right? And will it affect your studies at times? Yes, it would. And that will also be a learning, and you'll realize that you'll have to learn to balance. And it just brings a smile on my face because I do remember the years between 89 onwards. You'll have to learn to balance. And once you learn to balance, you'll reach somewhere. But you have to go through this. You'll have to go through your heartbreaks and you'll have to go through your relationships and have to go through your tough moments. You have to go through the exams. You'll have to go through all of that. And then and the other side is a fascinatingly beautiful career.
And the next question, I'm a third year student, but still it feels like I know nothing in clinical knowledge. Is it normal or anything that I have to improve?
No, that's true actually. If I was in third year, I also realized I didn't know much. Even today, if you'll ask me, I will tell you I know a bit in psychiatry and that's about it, and nothing beyond that. It's a good thing to realize that I need to know more. Simultaneously, I also need to know what I know. Feeling confident about your knowledge and recognizing you need more knowledge, that's the champion. Both things are important. And it's okay. In third year, I mean, we've all felt that. It's human.
And next question. So my friend is a great scholar, but due to any family or relationship issues, she's taking antidepressants now. Her academics is deterring. So how can we console her? She's worried so much of her studies.
So three aspects. If this individual is taking medications, it's a good thing because that means this individual is able to recognize what their concerns are, have gone to the right expert, taken medications as prescribed by the expert. So that's a good thing. And we all need to learn to respect each other because some of you will become surgeons, some of you will become physicians, some of you will be in diagnostics, some of you, like me, may also be in mental health. You'll all need to learn to respect each other's branch. That's one part. Second part, as friends and colleagues, you support, you be unconditional, you bring empathy. Don't be judgmental. Don't push. Help in taking breaks. Support. This is a phase. Like other things, this will also pass and there will be success around the corner. And even if there is a bit of a dip happening, it will be back. So the fact that help seeking has happened and intervention is happening, intervention will help most definitely to most people.
And the next question, remembering everything in MBBS subjects is challenging apart from
Impossible.
revision.
Impossible.
Is there any effective
Remember, it
method?
could happen. That's not going to happen. How can anybody remember everything? Bizarre it is. I remember in first MBBS, a senior gave me a book, which was a book on mnemonics. It was this thick a book to remember all those things about anatomy where you start from the skin and you keep going through. I told him either I can read this or read. I mean, how do you have a book on mnemonics itself? It's so bizarre. So you can't remember everything. It's okay. That's fine.
Bhanu, maybe in the interest of time, do we have many more questions or should we be wrapping up now?
2 more questions we have.
Dr. Samir, are you fine or
And
can we take on more questions? Okay, thank you.
So everything learning is important. या सिर्फ बेसिक और पास होना से सक्सेसफुल हो जाएगा?
Say that again, sorry.
I mean, scholar typed it in, Hindi. Is everything is important or only studying basic or taking a passing score is fine for a successful person or
I
something
don't
like
bother
that?
about the score, but everything is important.
Okay, how will the increase in the number of seats of MBBS affects the career ahead?
I wish there are more seats. I'm a firm believer that we need more medical practitioners. And I come from a branch which has about almost 200 plus shortage in our country. So if there will be more medical students, there will be more MD seats in psychiatry, and there will be more psychiatrists in our country. That's how I look at it. We do need more doctors. Don't allow yourself to believe that more seats means that you won't do well. That's actually not true. More seats means that all of us will do a lot better.
Yes, doctor, we are almost done with all the questions. Shrija, would you like to add anything?
Just wanted to take a moment to thank you so much, Dr. Samir Parikh. I think this has been a wonderful session, so engaging and so relevant the way you've connected everything with sports, and I think that makes it so much more relevant for all of us. I'm not an MBBS scholar, but even then, I think even if you're not, it greatly appeals and relates to everyone. So thank you so much for this wonderful session today and for taking out so much time to answer each question. And I'm hoping our scholars also, it was very insightful for them. Thank you for coming, and we definitely look forward to having you again. And yes, thank you so much to Fortis Healthcare also for your consistent support and for coordinating this event. And yes, thank you again. That's all from my end. Dr. Samir, if you want to say anything, or Bhanu.
Thank you. Thank you.
Thank you so much.
Pleasure.
Thank you, doctor.
Good afternoon.
Thank you, scholars, for joining and being engaging throughout the session.
Thank you, everyone,
Please
for
fill the
joining.
feedback form which was shared in the chat box.
Thank you. Thank you, guys. Thank you, Dr. Parikh, for your time and for the wonderful, insightful session. Thank you, FFE team, as well. And thanks to the scholars also who attended today.
Thank you so much. Thank you.